Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Myelodysplastic Syndromes, or MDS. Introduction. MDS is a group of disorders where the bone marrow does not work well and the bone marrow cells fail to make enough healthy blood cells. About 10 to 15,000 persons are diagnosed with MDS in the USA every year. MDS stands for Myelodysplastic Syndromes. Myeloid stands for blood cells, and dysplastic means funny-looking or misshapen. This patient education tutorial explains MDS. It first discusses its symptoms and causes, and how it is diagnosed and treated. It also includes tips for coping with MDS. MDS, Myelodysplastic Syndromes. MDS is a group of disorders where your bone marrow does not work well, and the bone marrow cells fail to make enough healthy blood cells. People with MDS may not have the right amount of red blood cells, white blood cells, and platelets. In patients with this disease, many bone marrow cells do not develop into working blood cells. Instead, many of these cells die off in the bone marrow. This is why blood counts tend to be low in patients with MDS. MDS is a disease of the blood. To understand MDS, it is important to first understand how blood cells are made. Blood consists of blood cells floating in plasma. Plasma is mostly made of water with chemicals in it. These chemicals include proteins, hormones, minerals, and vitamins. There are three basic types of blood cells: platelets, red blood cells, and white blood cells. Platelets are also called thrombocytes. They are small pieces of cell that help blood clot and stop bleeding. Red blood cells are also called erythrocytes. They make up almost half of blood. Red blood cells are filled with hemoglobin. That's a protein that picks up oxygen in the lungs and delivers it to cells all around the body. White blood cells are also called leukocytes. They fight disease and infection by attacking and killing germs that get into the body. There are several kinds of white blood cells. Each kind fights different kinds of germs. Blood cells are made in the bone marrow. That's a spongy tissue located inside some bones. It contains young parent cells called stem cells. Stem cells can grow into all three types of blood cells. They make copies of themselves all the time. These cloned stem cells eventually become mature blood cells. When blood cells are fully formed and functional, they leave the bone marrow and enter the blood. Healthy people have enough stem cells to keep making all the blood cells the body needs every day. People with MDS have an abnormal stem cell in their bone marrow. All the cells that come from this parent cell have the same defect. Many experts believe that MDS should be considered a chronic or low-grade form of leukemia, a cancer of the blood and bone marrow. Defects in stem cells can cause many problems. Blood cells may have an abnormal shape, size, or look that is not normal. This is called dysplasia. Blood cells may not mature fully or live as long as they should. This may result in too many young cells in the bone marrow and blood. It may also lead to not enough mature cells in the blood. People with MDS may have too many blasts in their bone marrow. Blasts are the youngest or most immature white blood cells. In normal bone marrow, no more than 5 out of 100 white cells are blasts. The number of blasts in the blood and bone marrow is some of the information used to tell how severe the MDS is. Types of MDS. The symptoms and the course of MDS may vary greatly from person to person. These differences depend on which blood cells are affected. All people with MDS have two things in common. They have a low blood cell count for at least one blood cell type. Their bone marrow and blood contain blood cells with an abnormal shape, size, or look. Doctors use two systems to classify the types of MDS. These systems give you and your doctor important information about your specific case. The two classification systems are 1. French-American-British (FAB) classification system. 2. World Health Organization (WHO) classification system. The following sections briefly discuss these classification systems. FAB classification system. In 1976, scientists created the first system for classifying MDS into subtypes. This system is called the FAB, or French-American-British system. It classifies MDS types based on how blood and bone marrow cells look. WHO classification system. In 1999, the World Health Organization, or WHO, published a new classification system improving the FAB classification system. This system was then updated in 2008. Its goal was to be more specific than the FAB in describing subtypes and in predicting what will happen to patients with each subtype. The system is based on patient data from around the world and on the most up-to-date knowledge of MDS. Doctors have also created a scoring system to help them understand how a patient's disease may progress over time. International Prognostic Scoring System. In 1997, the International Prognostic Scoring System, or IPSS, was launched. This system turns patient blood test and bone marrow biopsy data into a score. The score tells how quickly an MDS case is likely to progress and helps predict what may happen with the patient's MDS in the future. The IPSS looks at three things. 1. The number of blasts, or young white blood cells, in your bone marrow. 2. Whether your diseased bone marrow cells have abnormal chromosomes. The abnormal chromosomes in MDS cells are only in the diseased cells and cannot be passed down to a patient's children. 3. How many of your blood cell types are too low? In the IPSS, patients are given a score between 0 and 3.0. Patients can be put into one of four risk groups, 2 lower risk and 2 higher risk. Scores of less than 1.5 are considered lower risk. Together, the WHO and FAB classification systems and the IPSS are important tools. Together, they give you and your doctor key information about your specific case. They tell how severe your case is, what types of medication or treatment might work best for you, how your disease is likely to progress over time, how long you are likely to live. For more detailed information on the WHO and FAB classification systems and the IPSS, see the tutorial Types of MDS.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms and complications. The symptoms of MDS may vary greatly from person to person. The symptoms depend on what blood cells are affected and how low the blood counts have fallen. People who have early-stage MDS may not have any symptoms. That's because their blood cell counts are still close to normal. A person with MDS can have any of the following. A low red blood cell count is called anemia. Red blood cells carry oxygen from your lungs to the rest of your body. A low white blood cell count is called leukopenia. White blood cells fight infections in the body. The type of white cells which are most important for attacking and killing bacteria are called neutrophils. A low neutrophil count is called neutropenia. A low platelet count is called thrombocytopenia. Platelets help blood to clot and stop bleeding. If your MDS is in its early stages and your blood counts are not too low yet, you may have only mild symptoms. If your blood counts are very low, you will have more symptoms. If you have a low red blood cell count, your symptoms may include tiredness, feeling less alert or having trouble concentrating, pale skin, trouble breathing, rapid heartbeat, and chest pain. If you have a low white blood cell count, you are more likely to develop infections. These may include bladder infections that may make it painful to urinate or make you urinate more often, lung infections that may make breathing hard, mouth sores, sinus infections and a stuffy nose, skin infections. If you have a low platelet count, your symptoms may include bruising or bleeding more easily, even from minor scrapes and bumps, nosebleeds, tiny, flat red spots under your skin, which are caused by bleeding. These spots are called petechiae. These occur more often in the lower legs. Bleeding gums, especially after dental work or from brushing your teeth. Be sure to check with your doctor before getting any dental work. Causes. Most of the time, we don't know the exact cause of MDS. We do know that certain lifestyle factors are linked to MDS. MDS cannot be passed down through the genes from parent to child. It cannot be passed through germs from person to person. You may be more likely to develop MDS if you have been heavily exposed to certain chemicals, such as benzene, have had chemotherapy or radiation treatments, have been a smoker. We know that people diagnosed with MDS are more often men than women, most often age 60 or older. The average age at diagnosis is 71. Diagnosis. MDS is a complex disease, so diagnosing it is a complex process. Doctors use a number of tests to figure out exactly what type of MDS you have. To understand what is causing your symptoms and low blood counts, your doctor will take a detailed medical history. Your doctor may ask you questions about your symptoms, past medical treatments, and exposure to harmful chemicals. When trying to figure out the cause of your symptoms, your doctor will ask you for blood samples and a sample of your bone marrow. These samples will be used in a number of tests. The bone marrow tests show 1. Exactly what types and amounts of cells your marrow is making. 2. Levels of bone marrow blasts, the immature white blood cells. 3. Damaged chromosomes in the cells of your bone marrow. Sometimes it is good to get a second opinion. If you are seeking a second opinion, you should find a physician with expertise in treating MDS. One way to find an expert is by contacting a hospital affiliated with a medical university. Physicians at teaching hospitals are generally more familiar with rare diseases like MDS. Ask for the hematology or oncology department and for a consultation with an expert in MDS. Treatment. The main goal of MDS treatment is to help patients live longer. One key to achieving this goal is increasing the number of healthy blood cells in your blood. This is known as your blood count. When your blood counts go up, you are less likely to need a blood transfusion. Your quality of life gets better. Your symptoms are not as bad. Your doctor will look at several issues in finding the best treatment plan for you. These include your symptoms, your age, which type of MDS you have, your disease risk score using the International Prognostic Scoring System, other serious conditions or diseases you have, whether someone, preferably a family member, is willing and able to donate matching bone marrow to you. Treatments for MDS have a variety of goals. They may help healthy cells mature, increase the number of healthy cells in your blood, kill abnormal bone marrow cells, reduce the number of abnormal blasts in your bone marrow. The treatment options used for MDS include the following. 1. Wait and watch is an approach your doctor might suggest if your blood counts aren't too low and your symptoms aren't too bad. 2. Supportive care helps you manage the symptoms of your MDS. Its goals are to increase blood counts, treat infections, and treat iron overload. 3. Drugs which lower the body's immune response, immunosuppressive therapy, can improve blood counts in some patients. 4. Medicines recently approved to treat MDS can be used to stop abnormal cells from growing and stimulate the growth of healthy bone marrow cells. 5. Intensive chemotherapy treats MDS by using drugs that kill abnormal cells. 6. Stem cell transplantation, which replaces damaged stem cells in your bone marrow with healthy stem cells provided by a donor. Stem cell transplantation is currently the only cure for MDS. In the following sections, we will distinguish between treating patients with lower risk MDS and those with higher risk MDS. Treating lower risk MDS. The treatment options for people with lower risk MDS consist of wait and watch, supportive care, immunosuppressive therapy, and medicines recently approved to treat MDS. The following section has more details about these treatment options. Wait and watch. If you have early stage or very low risk MDS with minimal symptoms and you don't have a current need for blood transfusions, your doctor may suggest that the best treatment plan is to simply wait and watch. This will involve checking blood counts on a regular basis and keeping an eye on your symptoms. Supportive care. Supportive care is often the best treatment for lower risk MDS patients. A patient with lower risk MDS may not need blood transfusions, usually does not have an excess of blasts in the bone marrow. Supportive care can increase blood counts. It can reduce problems caused by infection and too much bleeding. This type of care includes the use of red blood cell transfusions, platelet transfusions, red cell growth factors, white cell growth factors, antibiotics, iron chelation to treat iron overload. Click on any of the underlined terms above to learn more about it. Your doctor may ask you to take a white cell growth factor along with EPO. This combination can improve red cell counts in some patients. Medicines approved by the FDA to treat MDS. The U.S. Food and Drug Administration, or FDA, has approved 3 medicines to treat MDS. They are azacitidine, Vidaza, decitabine, Dacogen, lenalidomide, Revlimid. Azacitidine, or Vidaza. Azacitidine was the first medicine approved specifically to treat MDS. It can be used by both low and high-risk patients with all subtypes of MDS. In some patients, it can prevent the growth of abnormal bone marrow stem cells and improve blood counts. It can be given as an injection under the skin or as an IV, where it slowly drips into your vein. It is given in a clinic or hospital. In high-risk patients, azacitidine has been shown to improve 2-year survival compared to a group of patients getting supportive care or chemotherapy. Decitabine, or Dacogen. Decitabine and azacitidine are similar drugs. Like azacitidine, decitabine can be used by low and high-risk patients with all subtypes of MDS. In some patients, this drug can prevent the growth of abnormal bone marrow stem cells and improve blood counts. Decitabine is taken as an injection in the vein in a clinic or hospital. Research has not shown that this drug provides the same long-term survival benefits as azacitidine in high-risk patients. Lenalidomide, or Revlimid. Lenalidomide is approved for treating lower-risk transfusion-dependent MDS in patients with isolated deletion 5q, whether or not tests show they have other abnormal chromosomes. It is a capsule you take by mouth, and it can be taken at home. Researchers are not sure exactly how lenalidomide treats MDS. Low-risk patients with deletion 5q have about a 75% or 75 out of every 100 chance of responding to lenalidomide. Many of these patients no longer need transfusions. This drug can also improve anemia in about 25 out of 100 low-risk patients who don't have deletion 5q. Immunosuppressive therapy. With some types of MDS, the immune system may attack the blood cells or the bone marrow cells, which make blood cells. Immunosuppressive therapy uses medicines to keep the immune system from attacking the bone marrow. This therapy helps some MDS patients, especially low-risk patients. The immunosuppressive medicines most often given include antithymocyglobulin, or ATG for short, and cyclosporin. ATG is given by IV, typically for 8 to 12 hours a day, for 4 days. It must be given in a hospital or other inpatient treatment facility. Cyclosporin comes in a liquid or pill form and is taken at home as an outpatient. Positive responses to ATG may last for longer than 2 years. As many as 30 in every 100 MDS patients may benefit from ATG, but doctors are still not sure how to best select patients for this therapy. As with any drug used to treat MDS, the beneficial effects of ATG are temporary. Treating higher-risk MDS. In patients with higher-risk MDS, blast cells will often fill the bone marrow, not allowing other cells to grow. Higher-risk MDS is strongly linked to the development of acute myeloid leukemia, or AML. Most patients who progress to higher-risk MDS will later develop AML if left untreated. In addition to the supportive care treatments, there are a number of options available to treat higher-risk MDS. They include azacitidine and decitabine are approved by the FDA specifically to treat higher-risk MDS patients. Intensive chemotherapy, drugs similar to those used to treat AML. Stem cell transplantation, also called a bone marrow transplantation. Click on an underlined term to learn more. Candidates for stem cell transplantation must be carefully screened. Some of the things your doctor will look at to learn whether you are a good candidate include your general health, your age, other medical problems you may have, the types of donors available for you. For a donor to be a match for you, they need to share some or all of your white blood cell proteins, called HLA proteins. If stem cell transplantation is an option for you, start looking for a donor right away. The first step is to get family members tested to see if any of them are a good match for you. If you do not have a matched donor who is a close relative, your doctor can help you search for other kinds of donors. After a stem cell transplantation, patients may require hospitalization for several weeks. Doctors will also require close monitoring and regular follow-ups with the patient for several months or even years. Clinical trials. Scientists are always looking for new and better ways to treat MDS. Clinical trials are controlled research studies of new drugs or treatment approaches. Clinical trials, also called research studies, can be a good option for some patients, even those that are just starting treatment. So, before you start any treatment, you may want to talk to your doctor about whether you may be eligible for a clinical trial. Good candidates for a clinical trial often include patients who have tried standard therapies, but it has not made their MDS better, patients who have had MDS return after standard therapies, patients who have not started any treatment yet. Before considering a clinical trial, discuss the possible risks and benefits with your doctor. Clinical trials have several objectives. They may compare new treatments or new combinations of treatments with standard treatments, help scientists learn more about standard treatments, test the safety and effectiveness of new treatments. Tips for living well with MDS. In addition to medical treatments you get, your lifestyle plays a key role in managing your MDS. By taking good care of your body and mind, you allow yourself to be as healthy as possible. Here are some tips. 1. Eat a healthy and well-balanced diet. Although there is no specific diet that is best for people with MDS, getting proper nutrition is important for healthy blood production. Because your nutritional needs can be affected by your disease and medications you take, you should check with your doctor about your individual nutritional needs and the best diet for you. 2. Get the right amount of exercise. It's good for your body to get some form of regular exercise. But if you have MDS, you may not have much energy to stay active. Plus, you may need to take special precautions. Your doctor can help you find the best fitness plan for you. If you have a low platelet count, you should avoid any activities that could cause bleeding. Ask your doctor about safe ways to stay active. Tell your doctor if you get a bad headache or pain. That could mean you are bleeding. If you have a low red count, you should ask your doctor about what amount of exercise and what activities will work for you. Tell your doctor if you have chest pains or shortness of breath when you exert yourself. Tell your doctor if you are going on an airplane or traveling in the mountains. You may need blood cell transfusions to make sure you get enough oxygen. 3. Protect yourself from getting infected by germs. Brush your teeth often to prevent the need for dental work. Dental work can cause infection. Check with your doctor before flossing. Keep minor infections from getting serious. Tell your doctor if you have a fever or feel very tired. These can be early signs of infection. Make sure your food is not too hot. Burns can cause infection in your mouth. If you have a very low white count, you might take these extra steps to protect yourself from infection. Wash your hands often. Carry a lotion that kills bacteria, antibacterial, when you go out. Use it if you can't find soap and water. Stay away from crowds and sick people. Your doctor may recommend a diet to keep germs out of your food and help protect you from infection. Here are some of the things you need to do if you follow this diet. Do not eat any cheeses that say aged on the label. Only drink milk that has been pasteurized to kill germs. Milk you buy from a supermarket is fine to drink. Stay away from homemade fermented drinks. This includes homemade wine, cider, root beer, ale, and vinegar. Stay away from buffets, salad bars, and crowded restaurants. Germs could end up on your food. Wash and peel fruits and vegetables very well before eating them. 4. Relax and reduce stress. Different people react in different ways to having MDS. Here are some other ways to take care of your mind. Join a support group. Learn more about MDS. Speak with a chronic illness counselor. Take an antidepressant medicine if your doctor says it will help you.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. MDS is a group of disorders where your bone marrow does not work well and the bone marrow cells fail to make enough healthy blood cells. People with MDS have abnormal stem cells that turn into abnormal blood cells. They may have too many blasts in their bone marrow. The symptoms of MDS are caused by low blood counts. A person with MDS may have a low red cell count that can cause you to feel tiredness and have low energy, a low white cell count that can cause trouble fighting infections, a low platelet count that can cause you to bruise or bleed more easily. In order to diagnose exactly what type of MDS you have, your doctor may take samples of your blood and bone marrow for tests. Thanks to advances in medicine, many treatment options are available to treat MDS. They include supportive care, such as red blood cell and platelet transfusions, antibiotics, growth factors, and iron chelators. Medication approved by the FDA to treat MDS, such as azacitidine, decitabine, and lenalidomide. Immunosuppressive therapy, chemotherapy, stem cell transplants. In addition to choosing and sticking to your medical treatments, you can play a key role in managing your MDS. By eating healthy, exercising, preventing infections, and relaxing, you allow yourself to be as healthy as possible in order to fight and treat this blood disease. The good news is that scientists are making great strides in treating MDS and its symptoms. Learning about MDS and joining support groups will empower you to cope with this disease. Your doctor and healthcare providers can give you additional information. You can also check the resources available at the website of the Aplastic Anemia and MDS International Foundation, www.aands.org.
Thank you for using Explain.